You're going to be involved with the TAT Congress, the Targeted Anticancer Therapies Congress. What are the most appealing sessions?
TAT is a fantastic meeting, and I think for this year's meeting in 2015, we're going to have many interesting sessions. Specifically, I'm interested in the new frontiers in immunotherapy. We're looking at many immunotherapeutic agents, not just the immune checkpoint inhibitors, which are obviously extremely exciting, but there will be other immune-based therapies.
Can you give us some pointers? Because here, for instance, we've been hearing in Madrid at the ESMO meeting that in fact some immunotherapies have been disappointing, and it is the more specific ones that hold out the promise. What do you think might be bearing fruit in the future?
Well, currently I think the anti-PD-1, PD-L1 antibodies are obviously already showing efficacies in many tumor types beyond the expected tumor types such as melanoma, kidney cancer. We're seeing activity in other tumor types such as head and neck cancer, bladder cancer, etc. But at the TAT meeting, we'll also look at other immune checkpoint inhibitors beyond the PD-1, PD-L1 axis. And in addition, there will be also, for example, immune-based therapies that look at cell-based therapy, such as the CAR T cells, etc., that are going to be presented, and the data will be quite interesting to share.
Right, so there's been a lot of progress in that field, has there, in CAR T cells?
Absolutely.
Coming along apace. And novel targets and combinations in therapy, what's coming up there then?
Well, at the TAT meeting, we will try and present the most up-to-date data on drugs that are of interest. So we will be presenting some data that are really hot off the press, many of which just, for example, finished dose escalation in phase 1, some of the novel targets. And some of these will be surprises. You will have to hear it as the final announcement goes out, because we want the latest and the hottest.
Now, when you're evaluating tumor response, with all of these new agents around, there are some differences, aren't there?
Absolutely. I mean, we are obviously very used to the RECIST criteria, version 1.1 being our current standard. But for some of the drugs, for example, especially for example the immunotherapy, there is a phenomenon called pseudoprogression where inflammatory cells can hone into the tumor, and using RECIST may not give you a good readout of the efficacy. So in the session that I will be chairing at the TAT meeting, we're going to look at criteria beyond RECIST, or how well we can assess tumor efficacy beyond the RECIST criteria. For example, looking at tumor modulation, whether the growth rate is changed as a result of the treatment, that is not just by shrinking the tumors. And there are many ways we can look at that.
And there has been a lot of controversy, hasn't there, about surrogate endpoints, which might not be the important ones for the patients. Can you throw any light on that with these discussions?
Yeah, I mean, there are biomarkers that are obviously very interesting, and in terms of imaging, there are also ways to actually integrate imaging endpoints with genomic endpoints. It's a whole new field called radiomics, which might actually be very interesting to shed light on the biology of cancers beyond just anatomical measurements of the tumors.
Now, can you give me a sneak preview then to the TAT conference in Paris in March? You're going to have some experts on these new criteria. What do you think will be the leading ones coming out?
I think coming out of it, people will start thinking that for certain drugs, beyond the standard criteria that we use for cytotoxic therapy, what other ways do we capture tumor biology and tumor growth modulation? And I think this will get them start thinking that perhaps there are beyond the RECIST criteria that we need to tailor to actually get a better assessment of these drugs' effects.
And what are the chances of getting those, and what are we likely to hear at the TAT conference?
Oh, I think you'll see data as well as people's experience using some of these new thoughts, applying it to the drugs that we have in the clinic.
So, what would you say to oncologists and scientists, cancer scientists, about the TAT conference and what they would get out of going there?
TAT's a very unique meeting. It is a group of experts in new drug development, and where new data are being shared, and is really exciting data that are not necessarily already out in the public. And I think this is a good way to also network with your colleagues who are interested in this area, drug development, biomarkers, immune therapy, etc.
Thank you very much.
Thank you.